The 12th of December is Universal Health Coverage Day, a critical moment for nurses to raise our voice, share our stories, and call on our leaders to invest in nursing and healthcare as the path to a healthy, resilient, and equitable world. This year's UHC Day focuses on financial protection. More than half of the world's population still lack access to essential health services, and nearly 2 billion people face devastating hardship from healthcare costs. No one should have to choose between essential healthcare and other basic needs like food, shelter, and education. It's time for governments to protect people with adequate financing to make sure all people can access the quality health services they need and when they need them. I'm currently co-chair of the UHC 2030 Steering Committee. As a member of the UHC 2030 Task Force, I participated in creating the action agenda that was fundamental to the recommendations in the 2023 United Nations Political Declaration on UHC, which gives country leaders a roadmap to advance universal health coverage and health security. With just 6 years left to reach our 2030 targets, we need urgent action. Without bold and sustained investment in our health workforce and systems, the world will fail to deliver on our promise of health for all. You know, nurses are a key part of the solution as the largest global health profession, and for many patients, the first and often the only health workers they see. Nurses around the world are already showing us what's possible by improving healthcare access in their communities, leading primary health teams, and delivering innovative models of care. There can be no health for all without nurses for all. It is now time for the world's leaders to address our global nursing shortage and prioritize building a nursing workforce that is strong, resilient, equitably distributed, well compensated, kept safe, and enabled to work at their full scope of practice. The evidence is clear that spending on nursing and universal health coverage is not a cost, it's an investment. When governments provide accessible care and protect people from crushing health costs, children stay in school longer, gender equity improves, and economies thrive. Every dollar invested in health returns dividends for years to come. We need decision makers to step up, wise up, and pay up because UHC is a net positive for people, for societies, and for economies. As our UHC Day slogan says, health is on the government, but it's on us to hold them accountable and rally for change. We hope that all nurses will be inspired to join us as advocates for UHC. This UHC Day, let's call on our leaders to make the right choice and invest in healthcare systems that leave no one in debt and leave no one behind.